Hi, this audio is going to follow the PowerPoint and discuss assessment and care of patients with fluid and electrolyte balances. This will just be the first, the introductory piece, and then I will segment it out and continue to cover this lengthy PowerPoint. So first we want to just talk about water in the body to begin with. So there's about 40 liters in an adult male weighing about 70 kilograms. And the water is kind of split up into different areas of the body. So we talk about cellular fluid or intracellular fluid, and that's the fluid inside the cells. We talk about extracellular fluid, and that fluid is divided into plasma, which is also what we call intravascular, meaning inside the vessels. And we have interstitial, which is between the cells, and transcellular fluid, which are things that are separated from other fluids by a cellular barrier. So things like cerebral spinal fluid, gastrointestinal fluids, intraocular fluids, synovial fluids. So those type of things. Our body wants to maintain homeostasis. And so our body tries to maintain a fluid and electrolyte balance. And so this is just another pictorial representation of the different areas that the fluids are in. So our body tries to maintain these fluid balances in a variety of ways, and we're going to talk about those briefly and then really think about how they impact us clinically. So filtration is the movement of fluid through a cell or blood vessel because of differences in water pressure, something that we call hydrostatic pressure. And hydrostatic pressure is really related to the water volume pressing against the confining walls. And so that's what's really, our hydrostatic pressure is going to determine filtration or have a large part in it. So hydrostatic pressure is the water pushing pressure. So we need to understand that. So it's the force that pushes water outward from a confined space through a membrane. And the amount of water in any body fluid space determines pressure. So the way to think about this is our blood pressure. So we're moving whole blood from the heart to the capillaries where filtration occurs to exchange water, nutrients, and waste products between the blood and the tissue. And I will go into this in more detail in just a moment, but you already know this. You know that nutrients, oxygen, things like that are pushed out into the cells, right, on the arterial side, and that deoxygenated blood waste products from the tissue are go back into the blood on the venous side. You know that. So just keep that in mind. And hydrostatic pressure is a pressure that one of the pressures that strongly determines how that filtration works. So one of the things we also think about is that pressure, if that pressure is high, such as if somebody has high blood pressure, particularly, that arterial high blood pressure, but also venous, then they start to get edema. So this is a picture of pitting edema. So diffusion is the movement of particles or solute across a permeable membrane from areas of higher to lower concentration. So this is important in transporting of electrolytes and other particles as they diffuse through the cell membranes. So we're going to look at sodium pumps, and also it is important to understand that glucose cannot generally enter cell membranes without the help of insulin. So glucose is a large molecule, and most larger molecules cannot just go in and out of the vasculature without help unless there's an issue, okay? Unless there's an issue with the body. So here's a picture of diffusion. So the movement of molecules through a semi-permeable membrane from an area of higher concentration to an area of lower concentration. So you can see that there's a higher concentration of molecules on the left side. And so some of those molecules are going to go over to the area of lower concentration to try to balance that out. So diffusion has to do with molecules. Now, when we talk about osmosis and filtration, so now we're adding osmosis to it. They act together at the capillary membrane to maintain normal extracellular and intracellular fluid volumes. So a thirst mechanism is something that helps osmosis and helps to maintain homeostasis. We'll talk about that more in a moment as well. Um, when we look at osmosis, osmosis is the water, so moves from areas of lesser concentration to areas of more concentration to try to decrease or equalize the concentration on both sides of the membrane. So you see that there's more water on the right side, and so water is moving to the left side where it's more concentrated to try to decrease that concentration. So remember, osmosis has to do with water. Now, here's the picture I want you to spend a little bit of time on, and I'm going to explain it a few times. You might have to listen to it a couple times, and then definitely as we have some discussions, you may have some questions about this. This is okay, but you do need to understand this. So a new term that we're adding in is colloid osmotic pressure. So colloid osmotic pressure is a pulling pressure. It is from the large molecules that are in the blood, in the vasculature, primarily our plasma protein albumin. So we talked about albumin before. Albumin plays a big role in helping keep fluid inside the vasculature where it belongs. So as you can imagine, albumin is a large molecule, so it should not be leaving the vasculature. Therefore, the pressure that is exerted, the colloid osmotic pressure exerted from albumin, you'll also hear it called oncotic pressure, should be constant throughout the capillary bed, whether we're talking about the arterial side or we're talking about the venous side, because it should not be leaving the vasculature. Okay? So we have a constant pulling pressure in the capillary bed. Now, the other pressure that we have in the capillary bed is our hydrostatic pressure or our blood pressure. We know that on the arterial side, we know the arterial blood pressure is higher than venous blood pressure. So on the left here, it shows our hydrostatic pressure being high, which it's supposed to be. Therefore, on the arterial side, the hydrostatic pressure or arterial blood pressure is higher than the colloid osmotic pressure. Okay, therefore, the direction of filtration of fluids and solutes go out. So on the arterial side, we're giving, oxygen, nutrients, things like that go out because the hydrostatic pressure is higher. Now, once we get to the venous side, we've lost solutes, we've lost fluid. The hydrostatic pressure now, there's less fluid there, it's lower. So the venous blood pressure is lower. The hydrostatic blood pressure is lower than the colloid osmotic pressure. Therefore, the colloid osmotic pressure, the pulling force, pulls in those waste products. It pulls in the things that we need in the venous side so that it can be filtered out. So on the venous side, the colloid osmotic pressure is higher than the hydrostatic pressure. So we're going to stop right there and make sure you think about that a little bit